Sonia, and let's talk about a really hot topic, masks. Everyone, including inside and outside of the hospital, are wondering a lot about these masks. Sonia?
Yeah, I mean, Tiffany, this has been a conversation for a long time, right? A lot of questions coming in. Should I wear a mask? Should I not? And particularly if you're not sick, should you be wearing one? We know that there's a critical shortage of masks, including surgical masks, not just those N95s. Well, right now, essentially, global health officials have said no from the beginning, since there's no proven benefit for the general population, even if there wasn't a shortage. Last night, though, on Nightline, the U.S. Surgeon General addressed concerns.
We recommend that people who are sick wear a mask. We recommend that people who are around someone who's COVID positive wear a mask, but do not recommend that the general public wears masks as a protective mechanism.
Okay, so that message has remained consistent since the beginning. But even Dr. Adams says they're looking into the benefit of those simple cloth masks. The head of the CDC also taking another look at data. A California researcher studied dozens of scientific papers, all COVID-19 success stories in Asian countries, and this was the conclusion he drew.
And they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%.
All right. In fact, China's head health official calls the U.S. and Europe not wearing masks, quote, a big mistake, because if nothing else, they can keep asymptomatic patients from infecting others. The White House, of course, being very active in this discussion around masks. Even President Trump saying anyone concerned could wear a scarf over their face or mouth if they wanted to. I just need to point out that we are not talking about the N95 respirator masks. Those are for healthcare workers who are dealing with sick patients, and those are in critical shortage. So again, we are talking about surgical masks here, which keep viral particles in. Those N95s help to keep viral particles out, essentially. If you have any more questions, you can hit me up on social media. Kara, back to you.
No, that's a really good clarification, because I was questioning the same thing just 24 hours ago. Thank you, Sonia. We appreciate it. A lot of anxious